Thank you all. Amr and Hadi, thanks for setting the stage for what looks like another great event. MedCity, thank you. Chicago's beautiful weather greeted all of us this morning. So it may not all be doom and gloom. Maybe.
Just
but
outside, though.
Setting the stage perfectly for this. So interest rates skyrocketing, right? Inflation, you've got capital leaving the space, you've got daily changes that are tough to keep up with, NIH funding coming back. I said it wasn't going to be all doom and gloom, but we'll start there. What do you think the longer term effects of this kind of environment? Actually, you know what? Let's do intros. That's probably a good place to start. Would you like to lead us off, Raffi?
Sure. Raffi, Boyajian, internal optimist. So, principal on the Cigna Ventures team.
My name is Amah. I'm also an optimist. I think it says on my LinkedIn headline. I oversee venture for VNS Health.
Hi, Dipa Mehta. How about I'm the pragmatist? And I'm one of the managing partners at Valeo Ventures.
All right, so I teed up the question. Now that we know who the optimist and the pragmatist is on the panel here. Raffi, you want to tell us what your crystal ball shows for the next couple of years?
In terms of the NIH funding or
Just the overall setting.
So, I'll start with, from the NIH perspective. I think, we don't invest in a lot of companies that have NIH funding, but I'll say that, there's a lot of funding that's gone into drug development and care, treatment programs that, have major impacts. So I think, maybe not directly that we're going to see the impact there, but long term, you could see things like, lag in drug development and other innovative solutions. So I think, as time goes on, there could be things like, increased increased utilization, decrease in outcomes, higher costs potentially. A lot of drug development have come through that. So I think that's one area to, just keep an eye on from that perspective. And, I'll keep it to that NIH audience, but leave it to
So we've seen a lot of headlines and a lot of cuts around the NIH, and everyone here knows that they are the #1 funder of biomedical research. I don't invest in drugs and therapies. I do a lot of the health tech work. But as I think about that, I ask myself, what does that mean for innovation? And I don't think that this is going to kill innovation by any means, but it's going to change the rules of the game just a little bit. And in certain aspects, it's going to slow innovation down, especially in the near term, where you're already seeing, and from a personal perspective, we're already seeing friends who are researchers not able to find net new jobs. You're seeing people having hiring freezes. So from the short term, you're going to see a slowdown in certain aspects. But you're also going to see acceleration in others, because when funding gets cut, you have to be more innovative and you have to be more efficient and effective. And technology today enables us to do that. Personally, what I'm curious about, and I think a key word you said is uncertain, is we don't know what's going to happen, is about these SBIR grants. So back in 2023, there was about $4 billion invested specifically in these SBIR grants, which gives a lot of entrepreneurs undiluted capital to de-risk their business. What does that mean? That means that entrepreneurs who are relying on these grants are going to have to get creative. And you're going to actually have to test and de-risk your business in different ways and go look for funding in ways that aren't undilutive, which means you're going to have to raise seed capital sooner. Another opportunity that I love for those that are building is you're going to have to look for partnerships sooner or go-to-market strategy sooner to actually de-risk your idea. So the way you do that's going to have to change. But by any means, there isn't, it's not going to kill innovation, right? We're going to continuously see net new companies being built in the space.
I think the way that I looked at it was kind of short term and long term. I think in the short term, it's this idea of, where are the priorities of the government really going to be? And I think that, I think 100 days in now, we're kind of seeing some of those priorities come out. CMMI just came out with areas that they're really going to be focusing on from a strategy standpoint. And I think that it's not, the long-term effects aren't going to be negative, it's just strategy shifting, right? It's like how large organizations, when a CEO changes over, or a chief strategy officer changes over, they reset what their strategy looks like for the next 5 years. And I think that's kind of where the government is now. And there'll be kind of a more, maybe higher focus on, food as medicine companies versus some of the other kind of value-based care initiatives that they had before. And so I think it's a shifting of that strategy. I think we're waiting to hear where those priorities are, and then really be able to kind of focus from an investor standpoint, because I think that's where you can be able to kind of see what the next couple of years are going to look like, and then for startups to really be able to adjust and investors to adjust to what that new normal looks like as well.
It's helpful. Just a question to all three of you. Have you invested, or any of your companies taken a good amount of NIH funding or grants or research capital?
Not many of ours.
Is it something that you look for in general?
No, we don't really. So we do more healthcare IT, healthcare services. So NIH hasn't really been part of our funding source previously, and kind of what we're looking at going forward.
Yeah.
But the NIH funding actually comes into play for us because our LPs are hospital systems. And so, when you're going out, and we're fundraising right now for a new fund, when you see large revenue sources for hospital systems go away, they're going to have to come up with what are those revenue sources, and makes the funding or fundraising cycle from my end be really difficult, because they can't make large dollar commitments to a fund when they kind of don't know where some of those fundraising cycles are. So it's a little bit different, from a lens standpoint from my end, but I think it's affecting everybody across the board.
So never let a good crisis go to waste. Now that we got that out of the way, at least in an opening, with change comes opportunity. So where are you all hunting for new opportunities? Where are some more of the exciting areas that you're spending more of your time?
All right, I'll go first. So, for Cigna Ventures, we really focus on, Cigna, the health plan, and then Evernorth, which is our care delivery arm. So, the areas we spend a lot of time are, and specialty pharmacy, for example, is a big one in terms of facilitating and accelerating access to various specialty drugs, and getting closer, or even partnering sometimes with the prescriber themselves. Oncology is a big area that we focus on too, in the entire care spectrum, and also how to impact total drug spend at the highest point. Women's health continues to be something we also spend a ton of time on in terms of the chronic conditions within the longitudinal care spectrum for them. And then, the last is really referral optimization, which I think is super important, and also the bi-directional aspects of it, and how to leverage those, high quality networks and make sure that they're going to work. So that's kind of like the big 4 areas we spend a lot of time on that translate to where the organization itself and Cigna is prioritizing.
Can I ask, on women's health specifically, how are you all looking at making the business model make sense, right? Like, a lot of the CPT codes don't specifically apply to certain conditions or specific care that's needed in women's health. So if you don't mind.
Yeah, well, I think, even taking a step back, I think women's health is it's kind of just a misnomer, right? It's like half the population, right? It's health.
Yes.
So I think it's just a kind of an odd label, quite frankly, because it just you should have things baked in already. To your point, they don't have the CPT codes. It just doesn't make sense, right?
Right.
And so the way I think we think about, at least me personally, I think about it is, Cigna focuses, from the health plan, they focus a lot on the commercial population, of course, right? So when we think of let's even just say, women in the workplace, right? What chronic conditions are associated with that, especially to keep them working and to keep them healthy? I think that's where we like to really play a lot.
Makes sense. Mon?
So when I look at healthcare, I like to break it down into 3 categories. No, there's a lot more than 3 categories when it comes to healthcare. The first, I like to call it the front end of healthcare. This is all around the patient experience. We heard the story earlier around the patient experience of enrolling, mom and dad onto Medicare Part A and Part B. I actually have a very similar experience because I did the same exact thing when it came to my parents. And my mom had to go to the ED and got a $40,000 bill. And I was like, wait, I thought she had Medicare Part A and Part B. But she was only enrolled to one and not the other. So then we can all agree, because every single person in this audience and here on stage, we're all part of the healthcare ecosystem. And we all have to engage in the healthcare ecosystem. And I think all of us can agree that our experience can be a little bit better. So I always focus on the patient experience because that's what matters. In the middle, I call it, what's in the middle of healthcare? That's care delivery. For that, I'm really looking at clinician experience. We're gonna have a shortage of healthcare workers. I think by 2030, we're going to have a shortage of 10 to 15 million healthcare workers. And we went 9 minutes without mentioning AI, which is very, very long today.
You ruined it. I was going.
I'm sorry. I was looking at the clock and I was like, how long till someone mentions AI and I'm going to be that person?
You're just facilitating the
You won.
transition, right? It's a segue.
I just segued it.
Yeah.
When it comes to clinician experience, we're seeing a lot of AI companies that are being developed, and that's not going to be the end-all be-all to solving the workforce shortage. So looking at clinician experience and how can we actually enable people to want to join the field of healthcare and enable people to actually want to come to work and do their job. So how do we make the burden less for them? That's the focus of what I call the middle, care delivery. And then I have the back end of healthcare. That's all of the stuff around automating workflows, leveraging a lot of the AI technology that we see today, everything around revenue cycle management. How do we automate the mundane tasks to really decrease the admin costs that we all see across all of our businesses to make things just more effective and efficient? So I like to break it down into 3 categories.
Helpful. Deepa, now that Aman's broken the AI floodgates,
Yeah.
where
So I think that they cover, and Raffi covered a lot of the things we look at. So our LPs are health plans and hospital systems. And so, we really invest in areas that they're really looking to really create innovative solutions around. And so, a lot of kind of what they covered is similar from a patient experience standpoint. Probably the only kind of other one that I would kind of bring up is, I think there's a knowing beyond kind of health systems now that care is not going to be delivered within the hospital walls in the next 5, 10, 15 years. And so where are those other, areas and places that you can deliver care at a lower cost and maybe do it in a value-based care way? And so, I think that there's solutions across the board, across different disease states to really be able to kind of affect that, but really kind of taking into account what does that patient experience look like, what does that drug spend look like, in conjunction with where is that site of care really. And so we've invested kind of across the board and, have now spent a lot of time on the telehealth side as well, both from a policy standpoint as well, because I think policy is really going to drive where telehealth is going to go in the future and how care is going to be delivered in that setting.
So a lot of strategic insight here on this panel, and there are, as we just kind of went through, a lot of changes in the potential changes in the care delivery payment models. Where are some of the more exciting, innovative areas that your strategic or your LP is encouraging you to explore? If you can divulge, if not.
Yeah, I think one of those areas, and again, I think that there's, there's a component of AI in a lot of the things that our companies do, but there might be really unsexy areas, like what does purchase services look like in supply chain for hospital systems, and are there cost savings there, right? That's not something that everybody talks about, but are kind of interesting kind of group areas to be able to say, are there margin improvements that you can be able to do using technology to automate workflows, like Aman was saying, and do a lot of other things because you're not necessarily going to be able to increase your top line as a large organization. So, but there are kind of margin improvements that you can be able to do to kind of change what your bottom line looks like. And I think a number of our strategics are really digging in deep to really be able to say, what are those areas, and then where can we be able to partner with companies, because we know that we're not going to be able to build a lot of this ourselves.
Yeah, I'm going to just piggyback off what Deepa said. It's all about that cost structure, right? You're always given a pool of capital, right? So if you're a health plan, you're giving X amount of dollars to take care of a patient, and you only have that X amount of dollars. And with those X amount of dollars, you have to use it and deploy it in the way that's going to change the patient experience for the better and really improve healthcare outcomes. At the end of the day, we make an assumption, we're all here because we want to change outcomes for the better across healthcare. So when you're given that pool of dollars, what are you going to do? And what can you do now? I always say, whenever you're building in something, figure out where the burning platform is. Because if you figure out the burning platform, especially for your customer or your buyer, you can actually build something truly remarkable. And we're always looking at ways to actually save costs for the business while making things more effective and efficient. So something that I personally often say is, how do we do things better, faster, and cheaper? And with how technology is continuously adopting and changing, I'm pretty confident that we can start doing this. We can start doing a lot of the things that we've been talking about for years and years and years, all leading to a better healthcare system for, at the end of the day, for the patient, which matters the most.
Raffi, anything to add?
Yeah, I mean, I think so. One of the areas you touched on, David, and then both Amah and Dipa did too, is sort of the value-based care risk arrangements. And so, the way we've kind of thought about it is really thinking about, what are the conditions that you can focus in on, and then what rails are there for value-based care? Because I think that's really important. So, for example, at Cigna Ventures, we invested in Monogram in late 2022. And what we really liked about it was, we really focused on the clinical outcomes and the financial savings. Again, to your point that health plans only have a certain amount of cap that they can work with. So how are we going to generate that and still have some, shared savings and maybe even some potential upside there? So, when we looked at that, we also said, okay, what rails were there? So there were government CMS programs that said, okay, this is how CKD patients can be treated, right? And then you had a company like Monogram that just basically took it and, just ran across with it, right? And so that's an important thing we tend to look at from risk standing perspectives. And then the third piece is we like that kind of predictable path that, a CKD patient or that can be on versus some other high spend conditions where it's a little difficult to predict. And then, internally for Cigna, one of the things we're already starting to with, going beyond fee for service in the commercial setting is these upside arrangements called collaborative accountable care contracts, which really focus on the health outcomes, the affordability piece, and the member experience that Amah mentioned as well. So I think we're starting to dip our toe there. And that's not nearly to like a full risk capitated basis, but we're getting there slowly but surely.
Awesome. Well, I feel like I have to address this. Did you know the Pope is from Chicago, too?
Yes.
And is a Sox fan?
Yeah, I did know that. I'm a Detroit Tigers fan, so it kind of. Yeah.
Well,
but you can't root against the Pope.
so Chicago Popes won, Detroit Popes.
Coming, up and coming, hopefully.
So coming back, Dipa, how are you guys looking at AI in general?
Yeah.
Where are the impacts going to be? How are you measuring ROI in the space?
Yeah.
It can be confusing, and I can get.
So I think that I think the analogy that I make maybe for me is AI right now is value-based care 20 years ago, right? There's a concept, it's really great. I think the business model is still in construction, but I think that there's a need for it, right? I think everybody realizes that everybody needs this if they want to be able to achieve what they want to achieve over the next 5 to 10 years. And I think the adoption is there, and the intention to adopt is there as well, right? And I think that the question for us has always been around AI is, what is that sustainable business model? I think that, we look at the buyers, right? We look at the payers and the providers that are going to buy this technology, and we say, how much are they willing to pay? And usually it's pretty small dollar amounts, right? In terms of what a payer and provider, to try to get a $10, $15, $20 million contract out of a payer that's not a care delivery, but it's just purely IT budget. Those are really big decisions that a CIO has to make in order to kind of do that. So, I think you can build a really interesting $5, $10 million company, but I think the question is always going to be, how do you create $100, $200 million revenue company? Like real revenue, not ARR, right? Like real revenue. And so I think that's always been the question for us. But we definitely see it as kind of a place where, systems are going to buy, payers are going to buy. It's just going to be a matter of, can you create a large company out of it, and what does that business model really look like? But for us, it's, we typically invest late Series A, B, and C, and kind of write larger checks. So we really look for like a true ROI, not, hey, it makes clinicians happier. It's, that's a really great kind of first number, but there's kind of layers beyond that. That I think you need to really dig into to be able to say, is this actually changing the workflow, and is it actually creating value?
I really appreciate you saying that, because it has not made much sense to me. This capital raises, the size of some of these rounds, and the perceived market size, that the investors have to be assuming that these companies will go out and get. When you look at the purchasing cycle of the health system, the capital and the budget compression that they don't have, let alone getting time and attention from the actual decision maker who is educated enough in the latest models and application to be able to purchase it and implement and have it affect the workflow.
And I think that I think that people are buying, right? You're seeing systems and payers buy these tools. I think the question is, can you get a $10 million contract out of them, right? And I don't, and Dave, you came from Providence, like I came out of Advocate, right? Like when you look at these large systems, what you want is to be able to get larger contracts, and I think that you have to really figure out what that business model is to get that larger contract.
Can you give me a niche then, or a space, that where you see an...
Yeah, I think, again, I go back to the value-based care analogy because I think there's a there to be able to say, can I be able to, get a base contract, PM, and then be able to share in the savings, right? And I think that there is a business model that works, but you have to prove out your ROI really early on if you want to do, share in the savings that you're creating and that you're actually creating real savings, right? And I think that you can do it. It's just a matter of time and then being able to get to that, prove that real ROI.
Raffi, Amah, at least from the payer's perspective, if value-based care is kind of where the bigger pool is for these larger contracts, is that where, would you agree? Are there other applications that you're more excited to go after applying AI?
When we talk about AI, I always like taking a step back and say, what does that mean, right? Like what is AI? I hear it. We went 9 minutes. A day doesn't go by when I'm at work where I don't hear it continuously, either from an investment perspective or from just my partners in the business, because they want to leverage it, they want to deploy it. So one, understanding what that is. I break it down to two different categories. One is like personal efficiencies, which is like me using ChatGPT to write my emails. It does a great job. It's actually better than me. And ChatGPT is a lot more empathetic than I am, so that's great. Then you have your operational efficiencies, right? That's around like revenue cycle management automation. You have so many agents that are actually executing phone calls. When it comes on when both sides, ROI is so hard to prove. We are testing and deploying a lot of AI in the organization. The most important thing for us is deploying safe, ethical AI, whether it's personal or operational. What I will say from spend a lot of time in the AI world. The technology is here. I'll say that every day. The technology is here. It's going to continuously change. Probably it's changing right now. It's going to change next week. It's going to change the week after that. But the technology is here. Enabling the organizations to adopt this technology, we're not here yet. And enabling organizations to deploy this technology, where David, you mentioned like getting a buyer who understands the latest model, we're not here yet. So how do we get there, and how do you actually get people comfortable with these decisions? That's going to be the hard part that I believe is going to happen. And I think there's definitely a want. There's an excitement, but the ROI is still unproven.
Yeah, and I can give a couple examples of where testing and deploying is really what we've done a lot. So not full on implementation, but a lot of testing. Some use cases, maybe even some land and expand contracts at some point. So, a couple areas we really focus on, in that exploratory phase in AI is the member-patient experience. So, things like testing out, AI in the prior authorization process and seeing, how to get patients on the appropriate course of treatment as quickly as possible is one. And then also for us, the administrative side for, call center routing, like how can you get them the right answer and the right insight, at a very rapid pace is paramount. Again, as we want to think about Cigna being seen more as a patient-friendly member experience company, right? And then, internally from like a core workflows perspective, we've implemented a lot of generative AI to our tools, to our work sets. And then we're testing AI assistance in a lot of operating production. Again, not full on blown, but a lot of the, again, on the assistant point of like, on the appeals process, client onboarding is huge. And then actuarial and underwriting is a giant piece of that, right? Where you can sort of work through those data sets. And then also for our provider group at MD Live, for the physicians, to your point about the clinical assistance, it's a big piece of it as well.
Yeah, you mentioned obviously rev cycle coding, prior auth. Matt, $4.7 trillion is what we spend in the US. It's the third largest global economy. Yep. And based on the stories that we've heard today, I would imagine that we very few people are having good experiences, and it's far from a sign of an efficient system. I always come back to McKinsey doing a study about 7 years ago that looked at the digitization of industries. Healthcare was third to last. It had beaten out agriculture and hunting, at least at the time. And that was until they created the name ag tech, and I'm sure that passed it, but right behind government as a sign of progression. So
I always ask myself, like, why are we so behind? And is this net new technology going to enable us to leapfrog? I think one of the things I read is like finance is 90% digitized, and healthcare is 10% digitized. And I think like more than 70% of healthcare companies still use a fax machine. I have no idea how to use a fax machine personally, right? But like, that's insane to me as to why. And then every single one of us, who mentioned it so many times, we use the healthcare system. Like, is anyone happy with it? Is anyone happy making a doctor's appointment? Like, but the technology that we see today and the ones that we're testing around these agents, like, they do have a better patient experience. Like, I've tested technologies where I can call in, it pulls in my whole EMR. It remembers everything that I spoke about the last time I was there. It knows the net new doctors I can go ahead and schedule for. It knows their automatic appointments and it can schedule an appointment for me. That's not the experience that we get today, but the art of possible is what excites me about healthcare. We actually can do that now, and we can actually serve all of us better.
So just along that idea of like, why is it different, right? I think that out of a lot of the other industries that I've seen, healthcare is just so people-centric.
Yep.
And I feel like there's so many emotions that are involved that are outside of just, your day-to-day, right? Of, what Aruthy was saying about being really emotional, trying to get this appointment and make sure that, her parent was covered, right? It's this idea of the emotions make it sometimes really hard to make really kind of rational kind of ways to be able to go out and do things, emotionally attached to certain papers, right? Or emotionally attached to how you receive information. You need to receive it from a person versus receiving it in a text message, right? There's a lot of this that ends up being behavior change, versus, I think there's a level of like areas that you want to digitize, but it becomes really hard when there's people and there's emotions, and that kind of carries through to how fast are things going to move or how slow things are going to move.
Yeah, I couldn't agree more. It's always like, I started my career in consulting. It was like people, process, technology, and we have like it's a people business at the end of the day. And driving change to people, it's one of the hardest things to do.
Yeah.
Yeah, you actually see that there is a direct correlation in malpractice rates to social skills of the physician, as opposed to actual clinical capabilities.
Yeah.
So, I personally, I think AI's greatest application can be applied even now in the labor shortage and in those efficiencies. But I feel like I have to give you guys a fun fact. So the Bears actually got their name because they're bigger than the Cubs. So football players are bigger than baseball. So if you're not getting anything from here, you can at least walk away.
Did you like look up these fun facts before you gave it?
Are you? He must be using ChatGPT.
Do they just come to you?
Yes, that one just did. No. So bringing it back a little bit here, give me, and Dipa, you kind of did a little bit too already. Give me a controversial take. What's an area that's getting a lot of attention that just may not be that interesting to you, or something that, and I don't mean to just throw it back to Dipa, anybody can jump in. Give me something meaty here.
You want to go, Amah?
I'm gonna contradict everything I just
said. Do it.
I'm gonna contradict everything I said, and
we're allowed to. We're investors.
We do, right? Every pitch deck I see is AI, right? And the reason I contradict it is like, does every business have to be an AI business? And I don't know how many entrepreneurs are in the room or how many people are building businesses, but when I started with companies earlier, like they weren't AI companies, and 24 months go by, now they're like AI powered. And I'm like, are you really AI powered? Like, what does that really mean? And I'm not smart enough to figure out if these models actually are the right ones. So I'm starting to see everyone just throw it into a pitch deck, which I don't agree with. I think you should always be, focused on building a great business. And if you want to leverage AI to build that business better because it can make the business operate in the back end better, that's great. But you don't have to be an AI-powered business to be successful.
Yeah. So maybe my controversial take is how companies get started now, right? So I think traditionally companies have gotten started, you have a great idea, you see a problem, you've got a great idea on how to solve it, you're gonna create a technology, and then you're gonna go out and sell it to customers. I think healthcare and technology are at a point where there's not a lot of new things to do. And maybe that's just me, right? And so I think where I've seen the most success now is creating companies with customers versus trying to create something on your own. And I think that's where you can really be able to kind of, if you're an entrepreneur in the room, you've got, really great ideas, that could be a really interesting place to start, because I think that it's really hard to start new, innovative companies in technology, in healthcare right now, just kind of given where it is. And I don't know if that's a controversial take, but that's my take at least.
I see it as a little controversial. I mean, I think it actually may be easier because you don't need as many software engineers or software developers, and being able to have AI help write the code. But then on the other side too, the barrier to entry shrinks, the moat is smaller or shorter, and so.
Well, you're building for purpose, right? It's
Right.
kind of where, but then you have to just figure out you're not building for that one customer. You have to build for a broad customer base, right? So there are pros and cons to this approach, but I think it's an interesting approach given where technology and healthcare is right now.
Please.
And how hard it is to sell to these customers.
So maybe it's not controversial per se, but value-based care, especially for, I think, early stage companies, isn't the holy grail. And I say that because I've seen a lot of companies start dipping their toe in there, or say, this is our, again, I don't focus on very early stage, is that, we're a value-based care company, right? And what happens is, right, if you start transitioning into that, you can get upside down on your contracts very, very quickly in terms from a financial perspective. Those get underwater, and those aren't even at full risk, by the way. Or what happens is, you start having to even find success. You have to raise even more incremental capital, right?
Right.
Put those on your books for capital reserves. Now all of a sudden you've got, shareholders, current shareholders, management teams, employees that are already diluted, right? So I think it's a great idea. I just think you have to have the right business model for it, and you really have to prove it out in terms of, to me it's fee for service, and take that next step, like a case rate, upside only. To me it's that. Progressive step, because you can get underwater very quickly.
So to that though, I mean, there are a lot of entrepreneurs in the room. What are some of the newer business models that you're seeing that seem to be resonating with customers? And I'll lead off because I'm the moderator and I can't. Is taking risk can actually help you shorten that sales cycle, offloading staff, and bringing a service component to your software application, I have found, seems to shorten sales cycles. But I'm curious, at least some of these more creative ideas that you're seeing some of your portfolio companies.
One of the areas I mentioned earlier was referral optimization. So I think as the pie of healthcare spend really focuses a lot on the specialty side, I think you can see companies, to me personally, it's companies that are in the referral optimization end, but also can facilitate that, on the subcapping side, right? Because I think that's I think the next level of the referral piece, where you're saying, okay, I can only send that cap over, and I can do it in an efficient, effective manner, and not lose money, or not lose that, again, a piece of that cap within that ecosystem or atmosphere of the healthcare system, where there's always these hands trying to grab a little bit of piece of the pie, right?
Yep.
Because I kind of think of it as like you have this pizza, right? And you can only cut so many slices until people are still hungry.
Right.
I'm just going to piggyback off that. I often say, like, everyone wants to take risk, but how many times are you going to, like, chop up, like, a patient and say, or a pizza, and say, okay, I'm going to keep taking risk? And it becomes really, really hard. It becomes hard for the payer, because they have to figure out who's going to get what piece of the pie, and it becomes hard for the business, because, like, it just becomes really, really hard to reconcile at the end of the day. So I couldn't agree more with Raffi and his point around, like, being a value-based care company isn't the end-all, be-all. Build a really, really solid business with a really solid business model that works. On the business model question, I think it's really tough. I mean, it is hard, and I don't have an answer for you as to what's going to work. I think what you have to do as an entrepreneur is focus on who your key buyer is and what are their greatest unmet needs and what are they willing to pay for. And then how do you work with them to actually build a great business, especially when you're early. I invest in seed to Series A businesses and couldn't agree more with Dipa, where like having that first anchor customer to really iterate on that business model becomes so important so you can go scale out. But I don't think you just have to have a risk-based company to be successful today.
Yeah, and what you said, Amah, is, and Dipa, you said it too, I think in question with a lot of healthcare solutions, it's who's the buyer and then who's the user.
Yeah.
Right? Because I think it becomes very difficult when you have,
Yep.
and you got to make sure, and if they are different, their incentives better be aligned.
Yep.
Because you're not sure who's going to use it in the most effective manner. And they're saying, well, I'm spending this, X amount of dollars, but I'm only using it for Y purposes. And so good luck trying to figure out the ROI there.
Yep.
Right?
Well, in so many instances, it's going to be, if the buyer is the employer, right, then you kind of have to go out and say, but the user is going to be the employee. And then you have to, base your ROI on the employer, but then really be able to go out and create the best experience for the employee, right? And so you kind of have to create these different moats to be able to kind of, one, differentiate yourself in terms of why would they pick you versus anybody else, and then really be able to kind of have that data to be able to back it up too.
Dipa, I'll come back to you as from more of a provider lens. With your software companies that are selling to providers, how do you balance the opportunity to increase your service revenue and increase service applications that you're selling, but being mindful of the erosion of the margin and the labor side of things? What's the balance?
Yeah, I think that there's this balance, right? Because I think I think there's an element of, I've got a technology that's really great, and I really think that it could be helpful to you as an organization. And then the second part is, of the buyer kind of saying, that is great, but I don't have the project managers, I don't have the software engineers, I don't have kind of the back end to be able to ingest your technology solution. And that's really when you kind of slowly kind of build up to say, okay, if I want people to use my technology, if I want them to build out, and be able to prove out my ROI, I might have to, on the back end, help them do that, right? And so I think that's where this kind of co-creation model kind of comes in, right? Are there elements, can they help you do it from an equity standpoint? Can they invest in your business so that you can be able to build some of those service engines? And, their other problem is they can maybe hire those software engineers, but they can't retain them. They can't pay them what they're used to. So working at a large hospital system might look very different than working at a startup. And most of them might want to actually go work at the startup and then have clients that are the systems, right? That's kind of how Epic started their whole kind of business, to not only have kind of the technology, but kind of have a whole implementation team on the back end. And that's kind of what it changed the game for them to be able to go out and sell their technology. But I think there's ways
capital.
to be, and there's
They also didn't take any outside capital.
Yeah, they also had, I
They
think
never acquired anyone.
but I think that they also worked with their clients to be able to say, if we do this, you have to pay us to do this, right? And so you can be able to be self-sustaining, but create kind of SOWs where you're buying your technology, but then also doing an SOW for you to be able to go out and help them implement it.
Arun, Hadi, you wanted to have some time for questions? Quickly, okay, because I could just keep giving fun facts too, if needed. So I'll open it up to questions, and while you're all thinking about that, I'll hit you with one more. So Chicago is actually home to the only permanently backward flowing river, interestingly enough. But
How do you know
it's
these facts?
permanently backward
He
flowing.
asked ChatGPT.
Like, is
This was
ChatGPT using your fun facts about Chicago? Just random?
There's a lot of fun facts out there, but this one just.
What year did the fire happen? That's what I want to know.
So I bought some time. We've got a question.
Let's see.
Or here we go.
Backwards flowing river. I'm curious now. Gotta fact check them.
I'm out of fun
Did you already
facts.
answer the fire question?
I'm sorry?
I was going to say 1871.
Yes, thank you.
Ooh.
Hi there. Thanks for the panel. I think about 5 or 8 years ago, there was a lot of discussion about blockchain was going to add all the security to healthcare, and it hasn't come to fruition yet. I'm just curious to know, do you think it might still, or is it still far away? And in what cases is AI the blockchain, and in what cases is it not? So, thank you.
I haven't heard blockchain in a long time. No, so I think the blockchain, at least from what I've seen, is still kind of part of the discussion, but it's more infrastructure, and it's not kind of in and of itself. It's been hard to create companies that are just blockchain companies. They're usually in conjunction with you use blockchain in conjunction with other technology that you're providing. And so I definitely think that it's there and some companies use it, but I would say companies that just had blockchain aren't really, I think what a lot of companies found was that it wasn't just sustainable to create companies that did just that.
Yeah, I mean, for an organization like Cigna, right, data is key. So I don't think, as just a blockchain company, they're not just going to let you borrow the data just to sit there, right? And as you start making those bridges to AI, right, is when you have the proprietary data, that's kind of the oil, right? In these models, right, that aren't going to go into, giving it to other areas as well. So I would completely agree with that.
I'm gonna add some fun facts about data.
Please,
Not Chicago.
if there is a such thing.
So,
Healthcare data?
33% of the world's data is healthcare data, and 80% of that data is unstructured. So I'm not a blockchain expert by any means, so I can't answer the question like they did, but the question becomes, is there an opportunity around blockchain and AI to support that?
I think it will come back, and here's a controversial take that maybe not so controversial, but healthcare data is one of the biggest, and data security is one of the biggest risks facing the U.S., but it's not a priority right now because of all of the other fires burning until it is a priority.
And I feel like it's starting to become a priority because of the breaches that we're seeing.
Yes.
And I think just in the past it wasn't a priority because we didn't see the breaches happening. But if you think about it, healthcare data, there's so much of our information with all of our health insurance companies and all the providers that we go with, and the cybersecurity in healthcare, that's going to be a growing field in my opinion.
Please.
Hello. Can you guys hear me?
Yep.
Yeah.
All right. So, Dipa, I thought you said something really interesting, which I don't agree with. Sorry, I wanted to be contrarian and controversial.
I got your back up here, don't worry.
I have to put you on the spot.
So you had made the point that healthcare has a lot of emotion, and that's why it's hard to change, right? Like it comes down to behavioral change. But when I look at the finance industry, right, like people have a lot of emotion attached to their money or the money they manage. Why is that industry 90% like digitized and healthcare is 10 or 30 or whatever, right? Like to me, there should be a critical factor that explains that differentiation.
I don't think that's the only reason, but I definitely think that there's, when you think about your finances sometimes versus, your healthcare, if you've got 3 different chronic diseases, versus, hey, I've got, bills that I need to pay, or a house I need to live in, right? And so your worries, kind of go across kind of different spectrums, but I think most people, if you kind of see when they're making their decisions, financial decisions, they understand, right? They understand 5 + 5 = 10, right? And so I can get to 10 using this methodology. With healthcare, your doctor knows more than you do, right? You don't know if, the node on your lung and what that means, right? Unless you use ChatGPT. That level of transparency and that level of knowledge looks a little bit different than finance too. So maybe that's where the emotions end up being a little bit more, higher versus in finance where you can figure out, what your dollar count is versus in healthcare, it becomes a lot harder. But, I don't think that's the only reason, but it's just a theory, honestly, to be able to say, are there reasons why people can't let go of certain things?
I mean, how many banks do you use versus how many doctors
Well,
do you go to?
that's where I was
Yeah.
going to go to.
The
It's like,
complexity.
the complexity is like, I'll give you a personal example, right? Like, I have issues with my lower back, so I go see a non-surgical doctor. After that, he's like, go talk to a surgeon. After that, it's like, go talk to a neurologist. Go figure it out.
Yeah.
And
I'd also just say, I mean, like, there is a reason why there's 4 Starbucks on 4 corners, right? Every 4 corner, because we don't change
Behavior.
And in healthcare, there's probably regulations that require all 4 corners to have a Starbucks. They're probably charging different rates for each coffee, depending on whoever walks in, and it's so many constituents and so many
Yeah.
regulations that it is even harder.
yeah, and yeah, I agree. But it goes back down to behavior change. And when we look at healthcare or look at anything we're looking to do, how do we change that behavior? And what's super exciting is for us as investors and entrepreneurs to figure out how do we make the experience better and how can you actually target that behavior change so we can make it more simple just for all of us.
Well, thank you all.
Thanks.
Thanks, David.